Governor, do you expect players, I guess especially in the moderate risk category like soccer and field hockey and cheer, to wear masks?
Why don't you come talk about that?
Good afternoon. Yes, that will be part of the modifications that we're discussing with the Rhode Island Interscholastic League, and my expectation is they would be wearing masks unless they were distanced. Some of the sports, if you're the goalie and all the actions at the other end, you could let your mask down, but that's my expectation for those sports that have more close contact.
If I could ask you, Governor, just two questions, maybe both of you. First of all, on a lighter note, Governor, the most important sport of all, as you know, is rugby. Absolutely. Absolutely. As a fellow rugby, is there any potential for a rugby season in the spring?
I think probably not. I often joke that my brief career as a rugby player was by far the best training for politics that anyone could ever have. It's true. No, I mean, I don't see rugby happening this fall. Okay. It's even more close contact than football. Maybe spring too, but fall too.
On a serious note, at the professional sports level, where there have been successful seasons at some level, hockey and basketball come to mind. They've operated in the bubble. And of course, the bubble means separate living facilities, separate everything. They live in an alternate reality. Even in a limited contact sports environment, it's, as any athlete will tell you, it's not just the game itself, it's the after-game showers, the close transportation in buses, all the other parts of being a team. You're in close quarters all the time. How do you control that in high school sports?
Yeah. So I want to address that, and then I do want to ask Director Coit, because she's really in the thick of it. So first of all, that's why I really leaned in heavily in this press conference to the coaches, the players, the athletic directors. We're gonna have to be vigilant around this in terms of, like for instance, transportation. They're working on ways so that it can be done with limited need for busing. There's gonna be new protocols for showering and changing, mask wearing, and you're right, it's a risk. The Interscholastic League has done a really good job of thinking through how you mitigate the risks, but the real answer is like enforcement on it by teachers and principals and coaches to make sure that the kids are following the rules. If they don't, we'll know quickly. We'll see outbreaks, and then we'll have to shut sports down.
Well, and is there the other part of being in that bubble is the level of testing? In fact, it was controversial early on because before there was access to tests, athletes were getting preferential treatment. So is that kind of constant testing going to be available to these high school teams?
It'll be, no. It's a good question. We do not have a separate testing effort for kids who play sports. Having said that, we have a really robust testing infrastructure for all K through 12, and we're going to be rolling out a surveillance testing for kids in school. So there'll be like a random cycle that kids will be tested, and including the athletes. No, this isn't the NFL. We don't have that kind of money. So, but we do want the kids to play, and so we're going to do our best. Do you want to add something?
Again, I want to commend the Rhode Island Interscholastic League, and they have a draft document now, but it's not just what happens on the field, it's transportation. They're thinking of things like having games only on weekends, one game a week. It's what happens on the sidelines, how far apart you sit, wearing a mask when you're not on the field. It's what happens in the locker room. So it's not just there is no bubble, but the guidelines and the practices that we're putting together with them will take you from what happens before, no fist bumping, to after the game. They're also, I just want to again emphasize the adherence. They're working with the principals, with the athletic directors, with the coaches to make sure those are enforced. So it's a structured environment in which we have confidence that the rules can be enforced.
Final question. Part of the issue with high school and particularly college sports has been not the athletes who are the fear of God of losing their opportunity to play, but it's been folks attending the events who have routinely, grossly violated social distancing. Will that be monitored as well?
It will be monitored. The current guidelines for sports have spectators included in them. The rules are no more than 2 people per athlete, and that any household should remain masked and 6 feet apart. The rules for school sports will put that obligation on the school to make sure that the spectators abide by it, and we will continue with the 250-person outdoor limit for venues of assembly. If it doesn't go well, that would affect, I know there's schools where they've stopped the game or changed the rules for spectators, but we have reason to believe that with those rules, we could control that, and the schools have told me that.
Question for the governor. Governor, so there are some districts that are not even trying in-person learning. I'm not sure how many, but I know of like Warwick and Coventry. Was there some thought to that unless you go back in person, that the athletes can't compete?
Yes, we had extensive discussion around that. And we decided that we didn't want to further punish the kids because the adults weren't willing to do the hard work necessary to get the kids back in school. We think it's safe to play sports, and especially if you're a kid who is going to be stuck in your room all day on a computer, all the more reason that you should get outside, play, be with your coach. A lot of kids rely on coaches to, for a mentor or someone to be with. I will say General Callahan, who's a key leader on our team, who's the head of the National Guard, spoke up forcefully in favor of this. As a father of 3 and spent 15 years as a lacrosse coach in North Kingstown, he said, Governor, you got to let all these kids play, because especially if they're in their room all day working, you got to give them a chance. So, look, you know my feeling about this. I think
Have the districts said that they would allow the athletes to participate?
no, just today as I'm making the
Today.
news. So today, this is why I'm encouraging them to. I hope that they let the kids play sports. Of course, I want them to go back to school too. So they'll know today, and we'll know next week what they're going to do.
Is there just some element of, though, incentive, let's just say, I don't know how many, but Warwick and Coventry, that unless you make an attempt to get these children back in the classroom, then you're not participating in school sports?
We thought about it. We thought about that, but we just thought that would be punishing the kids even further. And I hear you. We talked about it. Maybe that would have been an incentive to do the right thing and get the kids back in school, but it just felt like doubly punishing the kids because the adults weren't doing their jobs.
Just because you saw those Cumberland students, they had a protest. They want to be back in the classroom with their friends. Just one quick question. Where are we as far as the walkthroughs? Will that be, I believe next week, a number of the teachers are going in for professional development. What percent is that done so far?
A little more than half. A little more than half. Right? We've done 170. So I was close. 57%.
And when will that be ideally completed?
Next week, by the end of next week.
Okay.
Certainly before the 14th. It has to be before the 14th. So we're doing it all. And it's going very well. I mean, we're going to get feedback from districts saying, thanks for the help. We hadn't thought of that. We've been telling them you have to do a little better of a job at this, a little better of a job at that. So I'm pleased.
Governor, I know this follows up what I asked you yesterday, but you've now said it multiple times today again about some of these adults not making or doing the hard work. And I'm already seeing, pushback that this is minimizing their concerns and what they see as legitimate challenges. And it's not just an outlier here or there. There's schools doing hybrids and across the board in Massachusetts doing the same. Why do you feel it necessary to keep kind of pushing that message that they're not doing the work when I'm sure they would disagree that they're trying?
Because, first of all, they're right that this is very hard. And in no way do we want to minimize the concerns. So I want to be clear about that. I share the concerns. Believe me, I get it. I get the concerns. They are real. We love our teachers. We love our kids. We want them all to be safe. But I also see what's happening in some of these districts where they have more of a can-do attitude about saying we're going to do whatever it takes to get the kids back in schools, and they're making it happen. So I'm disappointed. Listen, Brian, my job is to look out for all the kids in the state. Kids are going to really suffer for not being allowed to go to school. You're going to have anxiety, depression, suicides through the roof. And you know who's going to hurt the most? Poor kids, kids with learning differences, kids who are already behind. So for me, it's a moral obligation, it's an economic obligation, it's an issue of equity. I know, maybe in those schools, maybe they can't get every kid back every day, all day, because the facilities are just, just can't handle it. By the way, I doubt it. But I know they could get some of those kids in school some of the time if they worked a little harder. Because I see it every place else. I see the can-do attitude in other places. So I feel that the kids need an advocate. And I'm speaking up on behalf of the children and the majority of the families who want their children in school.
And Governor, I just want to make sure I understand. So, but it's up to the district, say like
Right.
Coventry, so they have to decide if their athletes will participate this fall. Now, many of the coaches are teachers. So you could have a situation where they're saying it's not safe to go to school, but then they're going to coach them after school.
Correct.
Okay.
Correct.
I have a question for the doctor when we get to that. Anita, go ahead.
We'll do
Governor,
everybody.
to the walkthroughs, on Wednesday, you hinted that you would be open to allowing media to go along and tag along, but we were officially denied
Yeah.
by RIDE. So are you allowing media to tag along in these walkthroughs?
So we decided not. And basically because they're really working sessions. And after consultation with the Department of Health and everybody, we said no. We said these are really working sessions. The way they work is they're like a minimum of 90 minutes. The first 30 minutes, they sit down in a room and they just work. They go through the checklist, they go through the plans, and then there's more of a walkthrough. And it's back and forth. So we decided that for that reason, like any working meeting, it wouldn't be open to the press. Having said that, I think it's completely fine for some parents or some teachers or some union reps to be participating in the walkthroughs. In fact, I think that's helpful so they can be part of the problem solving. And so the districts that want to do that and have some of those folks go along, obviously that's their decision, but we're fine with it.
Governor, there's 17 states are playing high school football right now. I think there's another 6 or 7 going this weekend. I'm just curious what the decision was or what went into the decision to not have football in Rhode Island.
There are some states that are doing football. Some of them are doing it, like Vermont is doing just a flag football, I think 7-on-7, no tackling. We just didn't think it was safe. We're in really good shape. Our percent positive is less than 1%. We want all the kids to go back to school safely. We went around it and around it. I deferred to the experts in both sports and public health. It's tough with these kids. They're literally in football and in rugby, you're on top of each other constantly. It's about as close of a close contact as you can get, and we just didn't think it was safe. But we are hopeful that there will be football in the spring in this fall 2 season. So keep your fingers crossed there'll be a football season in, February.
With girls volleyball, Connecticut this morning announced they would be playing girls volleyball. Massachusetts is playing girls volleyball. Why not Rhode Island when we're kind of sandwiched between?
Yeah, same kind of thing. We just decided it wasn't safe. It's indoors. All the girls touch the same ball. I don't know if you want to add to this. It's just a judgment call. It's just a pure judgment call based on everything we know. Indoor sports, indoor spectators. It's just less safe. We thought about it. I don't know that there's any right or wrong answer. It's a judgment call, what we think is best for the kids.
Tanya Signori from the Rhode Island Echo to the governor. Speaking on behalf of people who don't have school-age children, and in particular small businesses, whether it's sole proprietors or not, will there be any other funding available for them? State funding, federal, CARES Act money, any miscellaneous money that came through to the state? Will there be anything available and the approximate time frame of that, when it will be available? And also, small businesses would like to know about the interest that's possibly being accrued on money that's not currently being used, if you could clarify that.
So I think there will be additional funds available. We earmarked the first $50 million, and we've dispersed, I think, about 5 of that. So there's another 45 that we're anxious to get out the door. We are looking to expand the rules to include sole proprietors, exactly what you're talking about. I don't have a timeline on that. I would say within the next month. Supposedly, Congress is planning to come back at the end of September to pass a stimulus bill, and there's a lot of talk about small business relief that's high on the list from what I understand. So I think the answer is yes, at least for those two buckets, if not, if not more.
For the doctor, I understand problems with certain sports like football, of course. I played center, and my recollection was that the job of the center is to be tackled on every single play because you start with the ball. But does sports as a whole, because it involves teams from different schools competing against each other, violate the cardinal principle that the state has established for the reopening of schools, which is to keep cohorts together and substantially isolated? So if you say, we are going to safely reopen schools and make sure that each classroom has a stable cohort of no more than 30 people and a teacher or two who are the same people throughout the day, throughout the week, throughout the month, throughout the semester, what happens when you are deliberately sending these pods of people to mix with each other, because of course not everybody playing the sport for the same school is in the same classroom, and then have them go to competitions where they're going to play against and interact with a similar group of people from multiple pods from other schools. And to me it seems that the risk is essentially what a mathematician or a statistician would call factorial. In other words, you're taking on effectively exponential risk here. So how do you monitor that? How do you measure that? And what have you calculated to be acceptable risk and not acceptable risk based upon things like your estimates of prevalence?
It's an excellent question. It's why we talk about layering to minimize risk. The majority of the sports that we are supporting happening competitively are focused on individuals, and so are minimizing groups of teams coming together to interact, and we want to encourage distancing appropriately, hand washing appropriately, and being outdoors. For the team sports that we are discussing and have shared today, we're going to really take what you asked about and what we've been looking at into consideration with the modifications. How do we layer it so that we minimize risk while being able to support, as General Callahan has reminded all of us, the opportunity for students to be able to have the physical activity, the emotional engagement, and the intellectual engagement that we know comes with sports activities. So we want to make sure the outdoors component is in place. We want to make sure things like Director Coit mentioned of cleaning the ball is in place, hand sanitizer, the ability to distance, the ability to wear masks where appropriate, keeping stable groups, and we're going to dig in a little bit deeper on what modifications we can do to further minimize risk, particularly among those team sports where we know those stable groups are together, but how do we minimize risk when we have one stable group engaging with a different one?
But that raises the question. First of all, you pick these numbers, gatherings of 15, classrooms of 30, based upon a statistical estimate of what you want the risk to be. In other words, what's the probability of somebody being in that group having an infection given the prevalence in the community? And that means that you have to pick those numbers and constrain these modifications based upon some sort of risk target and backfigure it from that. So that's kind of what I'm asking about. And that raises the other, frankly, toxic question of varying prevalence between communities. What do you do when, I don't want to single anyone out, but Exeter West Greenwich says we don't want to play Central Falls because their prevalence is 6 times ours.
So I'll start with the first question. A bigger part of the stable group component is actually to help us from a contact tracing standpoint and how we are preparing ourselves to engage were there to be a case, and the risk and the calculation of how many people could it have spread to, how quickly can we put a lid on it and prevent secondary and tertiary transmission, spreading to a large number of subsequent groups of people. So the calculations that you're asking about are really to help inform how we will do with monitoring the contact tracing component, who needs to be quarantined, isolated, for how long, what was the exposure risk. We will still be able to do that effectively with our stable groups coming together, even in a competitive situation, but that's where the structure that Director Coit referred to earlier is going to be critical in helping us effectuate that.
Would you consider athletes running by each other, close contacts? I know you talked about close contacts yesterday, but would you have to reach out to the other team if someone on another team tested positive, or would you not consider that a close enough contact?
We take each situation as it is based on the information that we learn. The direct close contact definition really requires less than 6 feet for 15 minutes of time. So a quick run past, especially if someone is wearing a mask, also outdoors, while people are hand sanitizing and we're keeping the equipment clean, has a much lower risk than someone who's in a huddle for, a half an hour being coached with no mask for a close period of time.
Doctor, you didn't get a chance to answer the second part of my question about, as my example, as Exeter West Greenwich, which is you play Central Falls.
Yep, I was about to turn back to you to do that. So a key component in looking at our data is really looking at the numbers. It's what sets Rhode Island apart. When Central Falls had the higher case rates that led to the indication that they would not be opening, and you looked over the course of the week, that was really 22 cases in Central Falls. That may compare to 10 or 15 or 20 cases in another community. We have to be clear in understanding it's not as if there is some stigma assigned to the communities that have a few more cases. It's a situation where we as an entire state want to make sure that each community has as few cases as possible and that we support each other. So I want to really implore, particularly on behalf of our students and the children who are involved, that the adults recognize that we are just talking about a small difference in the number of cases. There is not something that each child is at risk of carrying or causing harm to another child in any way. We want to help our entire state ensure that we have as few cases as possible and put the systems in place to allow our students to get the best education, in-person education as possible, safely, with the teachers that love them, willing and ready to do what's needed, and the best sports activity, safely done, supporting the emotional, physical, and intellectual well-being of our students.